Hello, everyone, and welcome to the July 2020 LabCoP session, our monthly session where we deal with various topics affecting our systems, particularly from the lab perspective, but we do touch systems in general in order to make sure that we get universal access to healthcare for everyone. My name is Anafi Mataka from ASLM, and I'm delighted to be your moderator today. As usual, this will be a 1 hour long session, which will be made up of a presentation first, after which we shall go into a question and answer segment. As usual, all of you will be muted during the session in order to avoid background noise. We appreciate that internet may be a challenge in some of the areas, so we kindly ask those that have videos on to maybe put them off so that we preserve the bandwidth. In today's session, unlike the few couple of months that we have gone, we have talked mostly about COVID-19. Today, we have decided to also acknowledge that life continues to go on despite the pandemic. And we want to touch at a very hearty subject in the name of early infant diagnosis of HIV. One might wonder why we continue to talk about this, which is a subject that has been discussed with so many tremendous innovations over time. Over the years, we have seen diagnostics coming through from high throughput instruments using DBS to point of care, like palatable, child-friendly formulations that have come through. But still, we still have a challenge. It's all because it starts from testing, from identifying these kids. I do not want to preempt much of the discussion today, but we want to talk about how can we make sure that these services are utilized. Our colleagues from the Global Network for People Living with HIV, Ms. Jo, to take us through the presentation, then we'll get into questions and answers. Ladies and gentlemen, before I hand off to Georgina, I want to remind people that we do have French language interpretation to preference. Over to you, Ms. Georgina.
Can you hear me okay, Anafi?
Perfect.
Yeah?
Thank you.
Okay,
yeah.
good. Well, it's really wonderful to be here with you. I've just scrolled through names, and I think besides my colleague Saima from GMP Plus and Maria from UNICEF, I don't actually recognize any names. And that fills me with a lot of excitement because it means that we're connecting with a different audience altogether. But it also makes me feel a little bit nervous. So forgive me if I'm a little bit nervous. But it's really wonderful to be with you. As Anafi said, I work with the global network of people living with HIV. And our mission is to improve the quality of life of people living with HIV. And that includes children living with HIV, which is the focus of today's presentation. So we have been, well, actually, before we start, I'd just really like to thank Anafi and to thank the African Society for Laboratory Medicine, so ASLM, for really inviting us to share our work with you. And I hope it will be useful for you. We come from a community perspective, a community of people living with HIV, but the work I'm about to share is for all CBOs. And let's see if it's applicable to others as well. But come from a community perspective, from an advocate's perspective, an activist perspective, and we really hope that yeah, you'll get a lot from today's presentation. And just to share that this work that we are doing is in collaboration with UNICEF and has been funded by UNITAID. So just in case you were wondering. Okay, so I'm going to share my screen. Anafi, can you see my screen? Just to make sure.
Yes.
Okay.
Yeah.
Awesome. Okay. So the presentation is entitled No Time to Wait, Promoting Point of Care Early Infant Diagnosis for HIV. And what I'm going to do is I'm first just going to get us in gently by speaking about early infant diagnosis, talking about just what's happening in terms of early infant diagnosis and what are some of the barriers to uptake. So why are babies not being tested sufficiently enough? And then I'm going to zoom in on point of care technologies and why they are really a game changer and where they are in use. And then I'm going to focus most of my presentation on taking you through this strategic framework that we've developed and a resource pack to support the strategic framework. And then we have a little video we're going to play for you. It's really short, it's an animation, and it basically summarizes my presentation in like, less than 2 minutes. But it's fun, and then we can have a conversation. So point of care early infant diagnosis, it's really, really, really important that we focus on testing of infants because the HIV response is truly failing children. So we often think, I think that there is often the illusion that we're doing really well with children because of all of the focus on PMTCT, but really this isn't the case. We still have a long way to go. So here in our own region in sub-Saharan Africa, just last year, so our 2019 data, it shows that only 61.2% of infants exposed to HIV, so exposed when they were in the womb or at birth or through breastfeeding. So 61.2% of infants exposed to HIV were tested within their first 2 months of life. And only 51.1% of children living with HIV were receiving ART. And there were 130,000 new HIV infections in children aged 0 to 4. And 58,000 AIDS-related deaths in children aged 0 to 4. So these are really very difficult numbers to take in because we have the services, we have the technology, we know how to do this, we know how to test babies, we know how to offer them ART, we know how to support the families and keep them alive. And yet these are the statistics that we're looking at. And a statistic that isn't on there is that without treatment, half of all HIV positive newborns die before they're 2 years old. And that number is really very unacceptable. So it's important that we really maintain the energy, that we maintain the focus, the investment on children. Now that data, so, we talked about 61.2% of infants were, tested, but when you look across several countries, you see that the numbers are even less. So just so that you can see that they really vary country by country. But if you look on this list, you can see that in the DRC, for instance, only 16% of HIV exposed infants were tested before 2 months of age, only 16%. That means a good 84% were not tested within, just within the first, ideally 6 weeks, but within the first 2 months of age. And if you look at treatment rates as well, again, looking at DRC, only 28% of children living with HIV are on treatment. At the higher end, ZIM, where we would still expect those numbers to be a lot higher, it's still 56% of infants tested and 71% on treatment. So these numbers are really not good enough, and they really call us to do more in this area. But in order for us to do more, we really have to understand what is happening. Why are we not testing infants when they are born or when they are newborns? What is going on? GMP Plus and ICW, the International Community of Women Living with HIV, a few years ago, we did a piece of community research around this very area. And mothers said they want to know the HIV status of their child. Of course they do, because they want their children to be, to also be able to access care and to live, to be healthy, to be able to stay alive, to be able to live their lives. But there are things that are stopping parents and caregivers from taking their children, from supporting the testing process, from getting their kids tested. So the first thing is, of course, fear and stigma. And we cannot, we can never stop talking about the issue of fear and stigma until we really seriously address it. We have parents and caregivers who they're worried about what the results would be. If the results are positive, then, what if that information gets out to others? What if the information about their baby's HIV positive status gets out to the wider community? In some cases, mothers may not have told their partners that they're HIV positive for whatever reason. Maybe they just found out during the antenatal process, in which case maybe, they're afraid to test their children. And some are just worried about how to cope. And once, when you've had a baby, there's a lot going on in your mind. I've got a little baby here sleeping right now, and there's a lot going on in your mind. So, you're really, really full of fear and stigma, and that cannot be overemphasized. There's also lack of information. Frankly, unless you're really in the know, unless you've come into contact with the right people at the health facility, you might not know that you need to test your baby or what that test involves and when it needs to happen. And then there's the issue of the health system. So the fact that not all clinics offer testing for infants. So in some countries, only certain clinics offer the test. And then it can take as long as 3 months to get a result, if at all. So you can test your baby, and then, the test, the sample goes off to a lab, and then, and then it needs to come back to the original health facility. And that process can take months. And so that means that parents might have to keep coming back to the health facility, which isn't always feasible because, it costs money, it costs time, and people have a lot going on in life. So there are health system weaknesses that are not helpful at all when it comes to finding out, a baby's HIV status. So within this context, you can imagine that point of care early infant diagnosis, that is quite a breakthrough. So the point of care machines, I don't know if you all know about point of care, but basically it's just a simple machine at a health facility, and basically you prick a baby's foot, and then you put the blood sample, through this machine, and then you're able to get the test result within the same day. So it's a really simple machine that allows you to get the result within the same day. So you can imagine that that's a real kind of, it's a real game changer, the point of care machines in this context. So there are many countries though that don't have the point of care machine. So that's an important thing to share. But I thought this would be really useful data to share with you. So with point of care early infant diagnosis, so a study was done comparing the point of care, using that testing versus the more kind of conventional lab-based testing. And results were returned to caregivers much more quickly. So they looked at a 90-day period, and they found a 30-day period, and within 30 days, 98% of the point of care test results were returned to the caregivers, compared to only 19% of the lab-based early infant diagnosis results. So people got their results much more quickly. The time between taking the sample and being able to organize for a baby to get their ART was also really reduced. 92% within 60 days compared to 43%. And so generally they found that infants began ART sooner and at a younger age. So 1.6 months compared to 3.3 months. So it just goes to show just kind of how, what difference having this kind of machine and this kind of innovation can make in the lives of, in people's lives. So these point of care machines aren't everywhere. And I don't know whether they are in more countries than what's on my slides, but this is the information that I have access to. So there are a couple of initiatives and programs that are funding point of care early infant diagnosis, and also funding the scale up of point of care early infant diagnosis. So I'm not going to repeat all the countries, but you can see them on the slide, and you'll see that they cover a number of countries in our region which have high numbers still of children being born with HIV. There's always a concern about, can we afford it? Like, why can't we have more? Can we afford it? Or is it, is it very expensive? A new machine, it must be very expensive. And I think generally speaking, there's a feeling that in those countries where, there are significant numbers of children living with HIV, that it's really very cost effective. And sorry, not just a feeling, there's actually a lot of research to back this up. So one particular study, which I mentioned here on this slide, showed that the total cost of running a test and returning the result to the caregiver within 30 days was much less with point of care, so $27.24, compared to the kind of traditional lab-based methods of which cost $131.02. So yeah, so I think that where in these countries where we know that there's still an incidence of and prevalence of children living with HIV, it's really important that we're able to test, and therefore by all means it's cost effective. But cost effective also in the sense that if you are going to be testing through the traditional lab-based methods and someone isn't coming back for their results, then that's really quite a waste. But also from a person's perspective, if you think about the children and you think about the parents and you think about the caregivers, then I don't even know how to talk about costing, because this is about children's lives, really. And it's about the parents being able to have the knowledge about their children's health so that they can support them to stay healthy. So within all of this context, we feel strongly that communities, community-based organizations, networks of people living with HIV, faith-based organizations, we feel have a strong role to play in promoting point of care early infant diagnosis. So we want to really improve those numbers. We don't want to see 59.1%. We want it to be 100%. We want all children exposed to HIV to be tested. For those who are positive, we want them to be initiated in care, and we want their families, we want to be really supported to take care of them so that they can live healthy and full lives. So we see a big role for community-based organizations in really being part of this kind of work and the solution around point of care early infant diagnosis. We feel that, communities, as communities, we know the issues that are happening around us. We know what our realities are. We know how to do things in ways that are real, that are, not medical, in ways that make people feel comfortable, in ways that make people feel that their rights are being respected. And so we really see a role for communities. And that's why we developed this strategic framework to be able to guide communities in terms of how maybe you can go about being part of this kind of work and creating demand for point of care early infant diagnosis. Now, as I share the strategic framework and the resources, if you are perhaps an NGO, or perhaps you work in a lab, or I don't know, in a health facility, you might find that this is a useful process, the strategic framework. You might find that the resources are useful, in which case that's really wonderful. So it's you know, hopefully applicable to other partners as well. But if you are an NGO or a health facility or a lab and you want to do something about it and you want to see more demand for point of care early infant diagnosis, then we strongly encourage you to reach out to community-based organizations in, you know, around you and partner together to do this work. So this particular framework, the idea is that we first want to improve understanding of early infant diagnosis. So there's a whole bit around, you know, what is early infant diagnosis, what is going on, what are the barriers, you know, what's happening. We also want to share knowledge of early infant diagnosis and point of care in particular. Like, we want to be able to support people to be able to share knowledge, with others in their community. And we also, and the purpose is also to really support community members to be able to advocate for improvements to services and to policies and funding around this area, and just to be part of the kind of monitoring of what is happening in communities. So we see communities really playing an information and education role, but even in the service delivery that sometimes community-based organizations are doing, being able to really disseminate information, link people to services, support those families, and just keep an eye on what is happening in the community. So the tool provides a step-by-step guide on how to develop an early infant diagnosis action plan. So I'm going to take you through that just so that you have a sense of what is in it in terms of the guide. And then we also have additional materials, which I'll show you, that can be used as part of this work. So as I mentioned, there's a lot of narrative text around early infant diagnosis, what it is and so on. But if I just take you to the step-by-step guide, so the step-by-step guide looks at 7 different steps. So if you are a community-based organization and you want to create demand, for point of care early infant diagnosis, where do you start? And that's what we mean by the step-by-step guide. It takes you through that particular process. And the first step is around assessing the situation. So, we provide a template, a framework, some ideas on how you can assess what is happening in your community. So what are the current kind of needs, opinions, knowledge, attitudes around early infant diagnosis and point of care in particular? What are some of the barriers and challenges that you can see in your community? And how can early infant diagnosis and point of care in particular fit in and kind of support? So we have a section on this, and for each section what we do is we provide templates, and they're not just blank templates. We've actually completed the templates to just give you an idea of the kinds of questions, the kinds of issues that you could be thinking through as a CBO. So after you have assessed the situation, next you need to kind of consider your capacity. So what kind of human resources do you have in place? What kind of knowledge and skills, expertise? What kind of money do you have in place to help you do the work? What's the data saying, and so on. And we recognize that, there might be some CBOs, you might have an existing program that you're doing in your country, you're partnering with UNICEF and EGPATH and others, to deliver some work. So this could be a project that you add to what you're already doing, or it could be something that just helps to enhance what you're doing, to sharpen what you're doing. But if you are a CBO who wants to be doing this work and actually you haven't got an existing kind of pediatric care program going on, then you might need to fundraise for it so that at least the staff involved in this work and volunteers are at least supported. So we have also included a fundraising template very specific to this particular topic and issue. So once you know you've assessed the situation, you've considered your capacity, you then choose your audience. So you choose, who basically is it that you want to target? Who are you targeting? Are you targeting mothers? Are you targeting healthcare workers, influencers, government to bring about the change that you want to see? And then based on that, you basically identify the specific objectives that you have. And then you create an action plan in terms of what it is that you're going to do to respond to the problem with the particular audience and the particular objective that you have in mind. So it's like a step-by-step guide. And this step-by-step guide, maybe it's something that you do anyway for your community mobilization work or your advocacy work. It's quite intuitive. But what we have done is to really tailor it to the issue of early infant diagnosis and point of care early infant diagnosis with examples, so that if you're holding a workshop, a one-day workshop, and going through this with community members, then you have some ideas. You're not sitting there with a template and then it's totally blank. So just to take you through, for instance, an example, if your audience was mothers, maybe it's mothers who are living with HIV, and let's say that your goal is to increase by 10% the number of infants being tested using point of care early infant technologies in the next 2 years. And then you see the opportunity being antenatal support groups and working with mentor mothers, then an activity could be to do a training session for the mentor mothers to talk about point of care early infant diagnosis, how it works and what benefits it can bring. So it's as straightforward as that, really. So hopefully it's not, activities and ideas that sound totally unrealistic or crazy. We actually drew this information from 2 networks of people living with HIV that we developed the tool with. In Malawi with Manette Plus, and in Senegal with RNP Plus. So with the 2 networks, we went through this entire process, and they were the ones, in fact, who helped us come up with the various kind of ways they would like to see, to kind of do the step-by-step work and the examples that we can put in the strategic framework. If you do have funding for this, or even if you don't and you've integrated it into your programming, it's very important to, of course, keep a record of how you are performing. And so we have a very simple M&E table that we have included, again, with examples of if these are your activities, then what might an output indicator look like and what might an outcome indicator look like. So that's also in the guide. And then finally, so these are in the strategic framework. The step-by-step guide is in the strategic framework with background information around early infant diagnosis and point of care in particular. But in addition, separately, we have a resource pack. And the resource pack includes a number of resources that you can use in your community mobilization work as you do your demand creation work. So we have a fact sheet for advocates. So the key questions around point of care early infant diagnosis. We have guidance for policymakers. We have, for parents and caregivers, we also have frequently asked questions for them. And we have a job aid for peer supporters. On top of this, we actually have posters as well. We also have posters, and the posters are really simple, and they really encourage parents and caregivers to take their kids for testing, and also really to also kind of reassure them that, you know, an HIV positive result is not the end of the world. It just means that you could save your baby's life and you can support them to get onto treatment and to stay healthy. All of these resources are available on our website. So our website is www.gnpplus.net. And if you do /resources, is it / or /? I'm not sure, but if you do / resources, you will see all of our early infant diagnosis point of care resources on the website. And they're free for downloading. They are available in English and available also en français. They're all there in English and in French, the strategic framework as well. And you're really welcome to download and to use. And if you want to adapt them, you can get in touch, and we can, of course, support you to adapt them as you see fit. At this stage, what I'm going to do is I'd like to show you the video, the animation that we have produced that shares with you information about the strategic framework and the resources. And it's really short, so you can watch that. And then I'll come back and then complete the presentation.
Hi, Saima.
Hi, Maureen. What are you up to?
Oh, I have been working on some resources to help people understand.
Can you hear it? Can you see it?
We could, but it's now just stopped, and it could be a little bit louder if possible.
All right.
But it just stopped.
Okay, just a second.
Hi, Saima.
Hi, Maureen. What are you up to?
Oh, I have been working on some resources to help people understand point-of-care early infant diagnosis.
I've heard about that, but why is it important?
Early infant diagnosis is so important, Saima, and we need to make sure everyone knows about it. We sometimes just call it EID. It's when we test babies for HIV so we can put those that test positive on treatment as early as possible. When infants living with HIV are not treated, the disease progresses quickly. Without treatment, up to 50% of children living with HIV die before their second birthday.
That is shocking. So what exactly is POC-EID?
POC-EID stands for Point of Care Early Infant Diagnosis. It is a test done at the health facility using a simple machine that looks like this. A blood sample is taken from the baby, put in the machine, and the test results are usually returned to the parent or caregiver on the same day.
That's great. I didn't realize it could be that fast. So what are the other resources you've been making?
The global network of people living with HIV have been working together with UNICEF to develop something called a strategic framework for community-based organizations. It explains the benefits of point-of-care early infant diagnosis and shows how community-based organizations can help more people access quality infant HIV testing.
That sounds really practical, and it looks so user-friendly.
Yes, it is. And we have also created a resource pack to support this framework.
What's in the resource pack?
There are lots of different things. We have an advocate's fact sheet, which is designed to encourage people to take their babies for HIV testing. There is also a tool for caregivers, which answers the questions people often ask about HIV testing for babies, which may encourage them to take their children for a test. There is a job aid, which is designed for anyone who regularly talks to, meets with, and supports communities affected by HIV. It explains how new technology makes it possible to produce test results more quickly, even diagnosing babies in the first few weeks of life.
This is amazing. So many resources. So where can I find all these things?
They're all available on the GNP Plus website.
Okay. Awesome. Okay. Now the animation we do not have in French, just for our French colleagues, très désolé, we do not have that in French yet, but we are working on that. So I just wanted to end by just letting you know that, you know, as I mentioned, we developed the strategic framework and the resources with our comrades in Malawi and in Senegal. And we now, fortunately, we have resources, again, through UNICEF and from UNITAID to pilot the tools in the countries where they were developed, which feels really wonderful, to be honest, because they were part of developing and conceptualizing. So it's great that we're going to actually be using the tools in these two countries. So that's the work that's going to be happening in the coming months. In that process, we're going to learn a lot about the tools and what works with the tools and what doesn't work with the tools. We really encourage you to use them, you know, if you would like to use them. And if you do, we would love to hear how you are getting on with them, and so that we can share learning together, and so that we could just, yeah, share and improve our experience, you know, improve the tools together. So do let us know. As I mentioned, the main audience is community-based organizations, but ultimately we know that these tools, point of care early infant diagnosis, it's, you know, it's a tool that it's the responsibility of the labs to be able to make sure that these tools are there, that they exist, that they're being used, that there's good training on it, and so on. So creating demand for this is definitely a collaborative, it has to be a collaborative thing between different kinds of players. And so it could be that different players, you know, those of you on this call, you're looking at this from your different angles and thinking about how could you, you know, how could you use this? Or maybe there are parts that are useful for you and not other parts. That's also fine. We're really open to hearing from you and just to kind of learning together. And I'm just going to close with these quotes from two colleagues who were involved in reviewing it from other networks and other countries. Oops, I'm going to not do the poll because I'll be very biased. Okay, I'm going to move the poll. So, Jackie from WOFAC said, communities have a role to really mobilize, give information, and create demand. And Edna from Kaola in Malawi said, the aim is to counsel, test, and initiate. But this only works well if work has already been done to ensure there's basic level of awareness about HIV. Pre-education needs to happen across the wider community. So I want to leave you with that message, with the message that, you know, communities do have a role to play in making sure that babies are being tested, and making sure that we can basically, you know, achieve the full potential of technologies and initiatives like point of care early infant diagnosis. So thank you so much for your time. And yeah, I look forward to the question and answer session and to sharing anything that I can.
Thank you very much, Georgina, for, for the lively presentation, wonderful presentation indeed. And I can pick quite a number of statements that you have mentioned that really touched me. One of which is being an HIV positive mother does not mean the end of the world. It only means that you do have an opportunity to get your baby tested.
Indeed.
And you also mentioned that creating demand is a collaborative effort for all stakeholders. It's not only for community-based organizations. We have also embraced that at the Lab Systems Community of Practice, ASLM LabCoP, by making sure that our country teams are multidisciplinary, from clinicians, laboratorians, program managers, donors, implementers, civil society, because we do acknowledge indeed what you have mentioned. And from the perspective of a laboratory manager, demand creation is very relevant, as relevant as it is to community-based organizations. we do not want all that innovation, all that investments that is in the lab to actually go to waste. Some statistics show that really, indeed, there are still mothers out there, there are still infants out there that are being born, but not tested. And as you have mentioned, mortality is very high, particularly when they are young. Colleagues, it's time when we really now go into the questions and answer segment. And we shall be taking questions from the chat box as usual. So keep them coming. And I see quite a lot of messages really acknowledging how brilliant the presentation was. So thanks a lot, Georgina, for that. I'm going to take the first question from Abdul Majid Suleiman Musa. And Abdul says, why did it take 3 months to get a result? Which test is being used?
So when I referred to that, I was speaking about, I don't know, I was just speaking about generally just conventional kind of lab testing as opposed to the point of care. And we heard this a lot from our colleagues particularly in Malawi, who said that, you know, if even when you get your, you know, a blood sample is taken, and by the time and sometimes it's taken away somewhere, and then by the time it's kind of tested and makes it back to the original source, then to the original health facility, then it can take 3 months, if not longer, and sometimes they don't get it at all. I don't know which specific lab related test they use there or in Senegal, like what they were referring to be honest. But I think it's less about maybe the test, but it's more about the kind of process and the fact that it just goes away and takes ages to come back, and it's just not done there and then on the spot. Yeah.
Indeed. Thank you, Georgina. And indeed, there are also studies that have shown that there are so many stages that could be involved in certain types of tests, particularly, I think, when it came to the conventional lab, when certain pre and post testing phases have not been effectively sort of optimized, the turnaround times have really been quite longer, and there are some studies to show that. Picking this up on, again, from a question from my good friend Ed Crisinius, where he just wanted to know whether, are we really happy with the 30-day turnaround time? What would be more acceptable to you? 1 day, 1 week, 2 weeks?
So, you know, in fact, when I was reading that slide, I wasn't feeling very comfortable about it, because what I was doing was reflecting on a study that looked at the turnaround time within 30 days. So it was an 8-country study that looked at turnaround time within 30 days. But what is acceptable to us is the same day. That is what is acceptable, to be honest. So you go in, you do your test, and you get the result that day. That's what is acceptable.
Indeed, I agree. Ideally with EID, ideally it should be same day, but this may not always be possible.
Yes.
So where it's not possible, I think we should always try the shortest ever possible, given the challenges that we do have, and limit the loss to follow up of our mothers and babies. There is also another one from Mulingazi Mango. He said, as you have cited the lack of knowledge or information of EID, what has or is GNP Plus doing to improve awareness, knowledge, attitudes, perceptions towards EID in remote and resource limited settings?
That's a really good question. And it's a really big challenge to us, but also, to be frank, to everybody on here. And I've just looked down the chat, and I also see Solange is on the call from ITPC, which is excellent. I think, you know, in a way, this strategic framework, the development of this strategic framework, and the resources that are part of the project, you know, that is our contribution. And we want to see this really rolled out with networks of people living with HIV in the lead. And at the moment, we have funding to do that with 2 countries only. And it would be great to be able to do that at a much bigger scale. And, but you know, I think that the issue about information, it's so important. It's really basic, but we take it for granted that, you know, when there's something new that people know about it, people don't know about it unless you put in the effort and the work to reach people with information and to explain it, and not just information, but to support them to be able to act on that information. So I suppose what I'm saying is that for our contribution as GMP Plus is really this particular piece of work that I've just shared. And over time, let's see whether there's a way in which we could scale up our efforts and support more networks of people living with HIV to use the resources to be able to reach others with information about early infant diagnosis. But there are other partners in the region, you know, including our comrades at ITPC, including many of you who are here, who are CBOs, NGOs, doing the work that you do. But the point that you made as well, Anafi, about, you know, labs, you know, really caring about demand creation, I think that's really important as well. So sorry, that's not a very satisfactory answer. I'd love to be able to tell you that we've got a great plan to reach the world with information, but we'll be doing our piece, and we hope that you will also join in doing your piece. Yeah.
Thank you, Georgina. Indeed, we all agree, and thanks Mlingazi for bringing up that question. And it's high time indeed we all try and do something about this. At ASLM, we have started, though it's a long way. Again, with ITPC, I would want to also bring Solange to also speak to that, where we have started not only for EID, but also for viral load. We are launching a social media hashtag campaign to try and make sure that we sensitize the community as much as possible. And touching on the same one, you mentioned that you have funding for 2 countries to go and do this. And there's Randall Dix from Liberia, where he says he saw a list of countries, but why Liberia? And what about the other countries? Do you have plans for us, and what are they? I'm not so sure whether you was talking about demand creation or the point of care one.
Yeah.
Yeah.
So the list that you saw, the slide with the list, are the countries where there is currently efforts to either set up or scale up point of care early infant diagnosis. So that was the list of 15 countries and 10 countries. So that's the list that you were speaking about. And I guess Liberia isn't in that list, in which case that's a good question for Anafi, because he's one of the people in one of the projects with the 15 countries, and the other set of projects are led by UNICEF. So it's a good question. I don't know. In our particular case, yes. So even Malawi and Senegal, in terms of doing the pilot, our main impetus for doing the pilots there is because they helped us develop the material as well. And they have particular interests. They're really interested, motivated to bring about change in this area. And we are a global network of people living with HIV, and our national networks have that interest. So we decided to partner with networks that were really motivated to do this work. So that's why we have focused on those 2 countries. Yeah.
Thank you, Georgina. Indeed, you mentioned those 15 plus 10. I know Maria is also here. We started with those 15 countries, and then UNICEF went ahead and added the extra 10, and we would want to see this moving up. This was more of catalyzing this. Ideally, like we've mentioned, we want the babies being tested in the same day, and also getting the required treatment, which is also now quite available and child-friendly as well. Solange has posted something in the chat. Solange, maybe you can also help respond to the question on what are we doing to improve awareness. I've just unmuted you. Hopefully you can be able to speak. Solange, are you there?
You've remuted yourself. Okay.
Oh, sorry. I am here, but not prepared at all. I think what I wanted to say is what I wrote. First of all, really excited to see this work coming, and thanks for sharing all that you've done, Georgina, within GNP Plus and the team there, the partners. I think this excuse about it, it's too expensive and it's not really reasonable, it's just never going to work, is really, it's old and done. We have to really push demand, whether it is for viral load or for EID. I think the demand creation is something that is critical to get the supply there. And I was saying that if we had the same attitude towards ARVs back in the early times of the response, we would not get test and treat today, for example. So we really need to figure out how to invest in demand creation, and which is not just lip service. People don't just magically know what to demand. So we're back to those parts of treatment education and education around the specific topic, and really investing in community-led interventions and communities themselves. Community-based organizations pay for helping them to get Wi-Fi, help to pay the rent, help to strengthen them broadly, which may not be very relevant to the labs per se, but these things are all very connected. So if we continue to think that it's super distal and it's so far away because you just want to think about the reagents and solutions and how the lab test is achieved, we don't see the bigger picture. So thanks for that opportunity.
Thank you, Solange.
Thank you very much, Solange, for that. Going on with our questions, another interesting question, I think it came privately here from Ed again. And he mentions, I think it's touching again on awareness. Where do smartphones fit into this relative to data and reporting?
Yeah.
What's the role of smartphones?
That's a good question, right? And that's something that we're looking for all across HIV now. We're talking about how do we use phones and digital health and around demand creation and so on. So the thing is, I think that's a very kind of context specific response. I think that if in a country where there is a lot of use of phones, where communities are connecting a lot with phones, like here in South Africa, then of course, if you go through the process of identifying what is the issue, who do we need to reach, with what kind of information, then indeed phones could be an option and a way of doing this, definitely. I think there are a couple of caveats in my mind. One is, again, if we think about the networks in Malawi and Senegal, they focused a lot on how do you work with support groups in particular, and they also looked at the issue of kind of reaching people in remote areas. And we got a sense that the one-to-one and the personal is what was really very important, because you're dealing with those issues of fear, you're dealing with, it's talking about really difficult things, issues around disclosure and so on. So that personal, the one-to-one and the connection and learning and being able to ask questions and to reach people, the one-to-one, in those spaces, it felt like that was actually really invaluable. And in fact, that's the role of community in knowing who needs help, who needs support, what kind of support, and so on. But again, that doesn't take away from digital as an option if that's useful. Many support groups, many mothers support groups would have a WhatsApp group. And in that WhatsApp group, they might be asking each other questions, or there might be, questions of the week, or, tips to share, or, reminders. And in that case, talking about early infant diagnosis and, have you taken your baby for their test? How did it go? Do you need to talk it through? And just kind of chatting in a WhatsApp kind of mentor mothers or support group. I could see that being a really supportive space for some to learn and to be able to also act. So the answer is that very possible that digital health has a space, but it's probably quite context specific.
Yeah.
Yeah.
Thank you very much, Georgina. And I keep seeing comments and questions coming through in the chat box. Thanks, George. Then there's Lara, who says, this is a great session and very timely. So thank you. As an FYI, there are now 5+ patient impact studies looking at POC AID, and they at WHO, Lara's from WHO, they are reviewing these and will be issuing a guidance. There will be a guidance meeting this fall to determine whether the current recommendation should actually be stronger or not.
Yeah.
So yeah, that's.
It should
then
be
there's
stronger,
also
Lara, it should be stronger. We can tell you that now. Yeah.
Then there is, this is from Estelle. What strategies can be used to encourage mothers to return for their infants' testing appointment for AID during the COVID-19 pandemic? I know I mentioned that we are not talking about COVID-19, but this is real. What measures should, what sort of mechanisms should be used to encourage this to actually come, given the lockdowns and the generalized fear of going to the facilities? Yet we are encouraging people to really come and get tested, and their kids.
So this is something that was actually on my mind this morning when I was thinking about this presentation. I was thinking, goodness, it's so hard already to go to a health facility to get your ARVs. Can you imagine going with a newborn baby, returning with a newborn baby to go get tested during this time of COVID? Is just, yeah, I find that really very, very difficult. In terms of strategies, to be honest, the most important thing is to be able to connect with the mother and to put in place for them a really safe process and space for them to be able to do that. So as long as we have a safe process, so how are they going to get to the health facility safely? And then we also have, when they get to the health facility, this is what you do, this is how we're going to take care of you, so that they feel reassured that they'll be well cared for. Then there's a bigger chance that they're going to actually make the trip. So I think that's, that would be my answer. So that does mean connecting with the mothers, which will probably happen digitally on a phone. So it means connecting with the mothers, maybe even accompanying them, ideally going to them, taking the service to them. But I know in some contexts that's unrealistic. But just supporting them basically to know that they are going to be safe in the process and making sure they actually are safe in the process and on their way back home. Yeah, we should have a person-centered approach to how we do this, because if individuals are happy, they are going to tell their comrades, they're going to say, my sister, this is what I did, I was fine and it went well. And what it's going to pass on through word of mouth. So providing a quality service and really taking care of individuals is also a really powerful strategy for creating demand for services.
Thank you, Georgina. I think the time is really, again, our enemy as usual. But it has been really a wonderful presentation. I just want to give you 2 announcements before we drop off. As you might have seen through the emails that we have sent early this week, We are excited that we have a new initiative at the LabCoP, and as member countries and through the multidisciplinary teams, we have sent out a call and a request for nominations of members who are going to be in our new sub-community of practice centered on monitoring and evaluation of programs, particularly for HIV, TB, and obviously one of the challenges that we have right now for COVID-19. So we are looking out for the responsible names to be coming. Please liaise with your leadership within the countries that we have received the communication. We have also sent out requests to have a quick quarterly catch-up with some of the first batch of the countries. So kindly respond to the doodle polls that have come to your inboxes so that we can determine the ideal times where we could actually be meeting. I just want to give 30 seconds to Georgina before we close to just give us a few words to sum it up.
Yeah. So just thank you again for the opportunity to share, and we were really very honored when Anafi reached out to us. For us, working with a group that works with labs is totally new to us. So it's also challenged us to think about the different roles that we all play, and indeed, as Solange put it, how connected we are in trying to achieve the same goals. So really, thank you for reaching out, and it's just amazing to be able to share. And please do use the resources, and if you do get in touch so that we can learn together. Thank you.
Thank you, Georgina. By way of logistics, many questions still continue to come through around how you download the certificate of attendance. There is a frequently asked questions section on the ASLM Academy page. Most of the questions have been answered. Where this is not clear, please continue to ask questions. And on the screen right now is the code that you'll be able to use to download this. Those who might have failed to attend to this can always visit the Academy, and you'll find the session will be uploaded there, and you'll also be able to listen to it. We will continue as usual with our weekly COVID-19 sessions, and we have also lined up another interesting session that will be coming in next week, possibly Thursday. So watch out for the announcement. Until we meet again, enjoy a good morning, good afternoon, or good evening, depending on wherever you are. Bye-bye, and thank you.
Bye, thank you. Thank you, Anafi, again.